Good morning or afternoon, everyone, depending on where you are. This is Unica Lewis with JBS International, and thank you for joining us for today's welcome webinar for the RCOR Neonatal Abstinence Syndrome grantee cohort. Before we begin, I would like to review some housekeeping items. Due to the high number of participants on this call, all participant lines will be muted for the duration of this webinar session. If you have any comments or questions, please submit them at any time using the Q&A feature. To open the Q&A window, please click the Q&A icon located at the bottom center of your Zoom window. If you experience any technical issues, please message us using the chat feature, which is located at the bottom center of your Zoom screen, or email us at rcor-ta@jbsinternational.com. Lastly, this is a recorded event and your participation grants consent to be recorded. The recorded webinar and PowerPoint slides will be available and sent to participants at a later date. Today's first presenter is Monica Russo, RCOR NAS Project Coordinator and Project Officer with the Health Resources and Services Administration. Monica, I'll turn it over to you.
Thank you, and welcome everyone to the webinar. We will be introducing ourselves throughout the course of this webinar, but before I introduce myself and my colleagues, I just wanted to provide you a brief overview of what to expect during this next hour or so. You have, with this grant, a wealth of information, a wealth of resources, a wealth of individuals to help you along the way. We're going to be detailing who those people are throughout the webinar. So to kick it off, we'll first go over the RCOR NAS program personnel here at HRSA, where we will better help you understand the role of your project coordinator and project officer, your cohort, grant expectations and deadlines. We will then pitch it on over to another HRSA key component, key group that you will be communicating with. That will be the Office of Federal Assistance Management. And that section of the webinar, you will better understand the role of your grants management specialist, better understand prior approvals, purchasing rules, etc. And then we'll flip it over to your technical assistance support, JBS International, to better understand the role of your TA support. And then we'll conclude with the evaluation support from JBS and OHSU to better understand the role of the evaluator during this process. And we will conclude with some questions and answers, time permitting. So with that, if we could go to the next slide. To kick it off, to better understand your RCOR NAS team from the HRSA perspective, I just wanted to present you with this graphic here so that you can really understand the programmatic components to your team here at the HRSA level. So we have here the program coordinator, which is myself, Monica Russo. I'm responsible for the overall coordination of the program administration. So it's my job to work with all of you, your project officer, your grants management specialists, the technical assistance provider that you will be working with closely, and really make sure everything moves smoothly. So, you know, the buck kind of stops with me here, but I also serve as your project officer or the project officer for several of you. I have about 15 of you as my direct grantees, and the other 15 have a different project officer. Our roles as project officer is to specifically monitor your project and progress. We are your primary program point of contact, and we are here to assist you with any programmatic issues. And that really means anything related to the NOFO that is specific to the design, the deliverables, the concepts, the focus areas, anything that is specific to delivering services within your community. We are your primary point of contact. And then you, of course, are the grant recipient, responsible for achieving project goals and activities, ensuring programmatic and grant compliance, and managing those federal funds in accordance with policies and procedures. So just wanted to provide you that graphic really quickly. And if we go to the next slide, you get to see our lovely faces. So I, of course, am Monica Russo. I am the project coordinator and project officer for 15 of you. Just wanted to show you our faces. I'll let Mabrat introduce herself in a second. But a little bit about me, I am a very enthusiastic person. I have been working in the field of public health, behavioral health for the last about 10 years. I've been working in coalitions and consortium for about 8 years. I hail from Florida, so a lot of the times when I'm on a call with you, I will be lamenting the tragedy of Maryland clouds and rain. So, please get used to that. I love sunshine, and I love talking about my experience within Florida, working really hard to advance behavioral health outcomes within Tampa Bay area. We worked really hard to redesign emergency room protocols to better help people get that initiation of buprenorphine before being transferred to a different provider for longer term medication assisted treatment. We worked really hard in cross collaboratives to better identify people who are high utilizers of services and really help coordinate care among those people better. And that was very difficult given the amount of partners at the table who have competing interests and coming up with great protocols that are HIPAA and 42 CFR Part 2 compliant. So I love being able to take all that I've learned in my previous career in Florida and really be able to help provide a great program for all of you in addressing the barriers and issues as it pertains to NAS, neonatal abstinence syndrome. I also have my doctorate in public health where I specialized in recovery themes and recovery research. So it is my honor to be your project coordinator and your project officer. I am also a very cheesy person. So I guess if you had to really boil me down to two key qualities that you'll hear on the phone often, it will be very Floridian enthusiastic and very cheesy. I make a lot of puns. So lucky 15 of you to hear me each month on those calls. Well, that is a brief overview of me. I'm going to go ahead and pitch it over to Mabrat to introduce herself, and she is the project officer for the other 15 of you. Mabrat?
Yeah, great. Thanks, Monica. Hello, everyone. My name is Mabrat Tekle, and I'll be working with some of you in the ARCOR NAS program. I also have, I think, about 15 of you that I'll get to work with, so I'm very excited to continue working with you and to officially meet you soon. Next slide. Great. So I'll be giving you just an overview of our office to just get a better understanding of the Federal Office of Rural Health Policy, and then I'll also go over the ARCOR program as well. So the ARCOR program is managed by the Office of Rural Health Policy, and the mission of FORHP is to provide policy support to the Office of the Secretary of Health and Human Services, and to also provide grant funding at the state and local level to improve access, quality, and financing for rural healthcare. And as you can see in this graphic, FORHP is made up of 5 divisions that support several programs. Some of you may have been grantees of, let's say, CBD or Hospital State Division as well. So we have a lot of grant programs that some of you may be aware of, but you may not be aware of our newest division, which is the Rural Strategic Initiatives Division, which houses the ARCOR program, as well as the COVID-19 Tribal Grant. Next slide. Great, so just a brief overview of the ARCOR program itself. It's part of a HRSA-wide initiative to combat the opioid epidemic among vulnerable and underserved populations. And you all may be aware that it's also a multi-year initiative supported by HRSA to address barriers to access in rural communities related to substance use disorder, including opioid use disorder. And then just some bullets to get you the impact to date. So far, we've spent 278 million has been awarded to support multi-sector consortia and rural communities and their efforts to implement and sustain substance use disorder and opioid use disorder services. So far, 1,117 counties and 48 states have been served. Please note that the total number of counties may not accurately reflect our FY20 grant cycle. We're still assessing those counties and numbers since we just awarded some grants for the FY20 programs. Next slide. Yeah, so just wanted to go over our cooperative agreements since this is a wealth of information and support for you all and our core grantees as well. So I'll start off with the ARCOR Technical Assistance Provider, which supports award recipients for our ARCOR planning, implementation, MAD expansion, and now our NAS programs. These are the folks that you'll be hearing from very often from JBS International. So you'll hear a lot more from them. We also have our ARCOR evaluation, which evaluates the impact of the ARCOR initiative through data collection and analysis, and to develop evaluation tools and resources for rural communities. And they will be speaking to you all later in the presentation as well. Also wanted to highlight our centers of excellence, which there are 3 of. If you see down below, the Fletcher Group, University of Rochester, and University of Vermont. And these 3 centers support the identification, translation, dissemination, and implementation of evidence-based programs and best practices as it relates to the treatment of and prevention of substance use disorder in rural communities. Next slide. Yeah, so just a brief overview of our grant programs. As you may be aware, our course started out with the one-year planning program in FY18. So that was the ARCOR planning, and the aim of that program is to strengthen the capacity of multi-sector consortia to address opioid use disorder prevention, treatment, and recovery. And as you see down below in the number of awards, we just awarded our 3rd round of planning in FY20. And we also have our implementation program, which aims to strengthen opioid use disorder delivery through implementation of a set of core prevention, treatment, and recovery activities that align with the HHS 5-point strategy to combat the opioid crisis. So we also awarded recently an FY20 cohort of the implementation grant program as well. We also have our MAD expansion program, which aims to enhance access to medication-assisted treatment within the small rural clinics, hospitals, and tribal settings, and that is an FY19 program. And then we are also I'm also going to talk about our NAS program, which is our newest program. And as you may be aware, the aim is to reduce the incidence and impact of neonatal abstinence syndrome in rural communities by improving systems of care, family support, and social determinants of health. Now I'll pass it off to Monica to tell us a little bit about the NAS cohort. Monica.
Monica, you may be on mute.
Oh, I've been on mute. Hot dog. Thank you. Thank you, John. Thank you. Yes, we'll just start right over there. So yeah, on this slide here, you can see this is a little bit of information about all of you, the new ARCOR NAS cohort. As you can see on this slide, you all represent 21 states, which is very impressive given that there are only 30 of you. We're just so excited that you are scattered as you are. You will notice that this says Maryland twice, MD. Please note that that second MD should be an MO for Missouri. So yeah, that is where you are all located. We're just so excited to have you on board. You all represent pretty diverse organizations. We have 6 academic institutions, 3 critical access hospitals, 3 community-based organizations, 4 federally qualified health centers, 3 rural health clinics, 1 tribal organization, and 1 county government. So welcome to all of you. We are, of course, excited you're here. Next slide. Just a little bit more about all of you. 9 of you are brand new to the ARCOR program, so welcome. We're thrilled that we are able to have new people apply and compete. We're very excited about that. We're also very intrigued by the breakdown of focus areas among all of you. We thought there would be a little bit more of a distribution with all of these focus areas, but it turns out most of you are going to be focusing your efforts on integrated care and care coordination. The second most popular focus area is advancing family support services. There appears to be no one in this cohort who's focusing on transportation. That's okay. But yeah, this is just a little breakdown about who all of you are, and we are very interested to dive deeper into these programs and better make headway in your focus area of choice. Next slide, please. Now, I want to go into the expectations, the immediate expectations moving forward, along with some of the longer term expectations of the grant. And to do that, we'll go over your notice of award, really go into those terms and conditions, better discuss those reporting requirements, those deliverables, review some of those upcoming due dates, and of course, at the end of the webinar, be able to answer any outstanding questions you might have about some of those pending due dates. Next slide, please. Now, all but 9 of you are for certain familiar with RCOR. I know we have at least one of you who is brand new to HRSA, so there might be more than just that one. So I just wanted to review this notice of award document with all of you just to make sure that you are well accustomed to knowing where the important information is. So of importance on this slide, as you can tell, item 4B on your notice of award is your grant number. That's very important to have. We absolutely request that every email communication that you write includes this grant number. This helps us a lot, especially for your grants management specialists who might have 50, 60, 100 different grantees that they manage. That grant number is very important to keep us organized. The items 6 and 7 help you better see what your period of federal support is. Item 10 is the project director. Items 11 and 19 are the amount of federal funds awarded, and the last page includes your project officer name and your grants management specialist name and contact. So really quickly, if you are focusing on, or if you're looking at your NOA, please make sure that your project director is accurate, that it is reflective of the person who is the project director. If there is anything different, please let us know. That is something very important for us to correct early on. Next slide, please. So just some standard terms that are not exhaustive at all. We're not going to go through that, the whole compendium of terms in your NOA, but just a few that are important to highlight are listed here on the next few slides. This first one is about language. And when you are issuing any press releases, certain statements, requests for proposals, it is very important to make sure that you use the language that is provided here on this slide. It is also in your NOA, but it basically just alludes to the fact that the materials are supported by this specific funding. It's very important. Something that has been updated is the salary amount, which is now $197,300. That is the maximum amount to be charged to HRSA grants and cooperative agreements for any person's individual salary. That is the absolute max. There are plenty of terms in here that reference prior approval. Just really want to emphasize that rebudgeting prior approval request, which is necessary when rebudgeting is about 25% or more of your year one of the grant. So please keep that in mind. If you are ever at all concerned that you might be getting closer to that 25%, just let us know. We're happy to help discuss with you whether or not you need a rebudgeting prior approval. Next slide, please. So now going into the more RCOR specific terms, since you all applied for this grant, I'm sure you are all very familiar with the ins and outs, the requirements, the design and such, but just to review really quickly, the target service area, the target population, and the consortium membership of this grant are very important. All services provided by the RCOR NAS grant must exclusively occur in HRSA designated rural areas. There are very few exceptions to that rule. So if you are at all concerned about that, reach out to us. We're happy to discuss. The target population for this grant is, of course, women of childbearing age who are at risk of substance use disorder. But as you know, we also have extended that target population to embody their children, families, and caregivers who reside in HRSA designated rural areas. So that is a very important target population. We want to make sure to properly address the needs of the full family unit and community to better tackle the underlying causes and challenges related to neonatal abstinence syndrome. The last one on here is consortium membership. It is absolutely the responsibility of the project director to inform the HRSA project officer if the consortium composition changes so that it is no longer meeting the minimum requirements. And I just want to refer back to the notice of funding opportunity to kind of trigger your memory on what those consortium membership requirements are. If any of those should change, you must let us know. You must always have 2 members who are located in rural communities. You must absolutely have at least 4 members unless an exception applies. So please just go back to that notice of funding opportunity. Make sure you know those rules very well and let us know should anything change. Next slide, please. The other items that are specific to this RCORE NAS program are the prevention, treatment, and recovery strategies. It is a term of this award that RCORE NAS grantees must make progress towards completing all 6 of the selected prevention, treatment, and recovery strategies. That means that all 6 must be worked upon each year during the period of performance. It absolutely will not be sufficient if your consortium works on 2 prevention strategies in year 1, 2 treatment strategies in year 2, and 2 recovery strategies in year 3. You must be working on all 6 for the full 3-year period of performance. Similarly, you must also be working on achieving the financial and programmatic sustainability beyond the period of performance and must continually engage in activities to include or improve collaboration with Medicaid offices and reimbursement arrangements. Very key components to the grant. Next slide, please. Regarding personnel, for those of you who have different RCORE grants, you might have noticed that we added something new this year. In addition to the project director, we are requiring a data coordinator during the entire 3-year award period. We absolutely need to know the names of both of those people. If that should ever change, that is something that we expect you to communicate with us so that we can update our records. For the full-time equivalent, this is something that everyone should be pretty familiar with, but for any given staff member, RCORE NAS grant recipients are not permitted to bill more than 1 full-time equivalent across federal awards. And this applies not just to the applicant organization, but any consortium member receiving RCORE NAS funds. So if you have a consortium member receiving any RCORE NAS funds from you, that consortium member cannot bill more than 1 full-time equivalent person. We are happy to answer any questions you might have on that. And our next presenter is very great at explaining and describing all of these rules and regulations in a way more fun manner than I do. So I will go ahead and expedite the rest of these slides so we can get to him. Few more things regarding meetings and HRSA funded technical assistance. You can see that here on this slide. The meetings, I just want to adjust really quickly. You probably noticed in the notice of funding opportunity that you are expected to send 2 staff or consortium members to attend a 3-day meeting in Washington, D.C. Of course, there is a pandemic occurring, so we will not be planning on having that in person during the 2021 calendar year. We are planning to have that virtually in the summertime. So of course, these are terms of your award, but also, of course, there is flexibility here as we are all working to figure out best travel procedures and protocols and you know, trying to forecast the future of this pandemic. The other item, the other meeting that is expected of you is the attendance of the regional meetings. Those will also be virtual, and that information was sent out in your welcome webinar or in your welcome email. We will be discussing that a little bit later on in the webinar when we turn it over to the TA provider. A little bit more about that TA provider. You are expected to work with your TA provider and evaluator throughout the 3-year grant period. This is a great opportunity for all of you, especially the 9 new ARCOR recipients. I can't speak higher of the technical assistance provider. It's a great resource to help you problem solve all of the really important work that you will be doing. And the evaluator will be there with you to really help you properly collect that information and data so that we can tell your story and you can better see your efforts and the data and be able to tell that story on a local level as well. Next slide, please. Communications. So our core NAS grants recipients are expected to participate in those monthly progress calls with the project officer and TA provider, and expected to respond to inquiries and requests from HRSA staff in a timely manner. This really does help. Those monthly calls are really important, of course, to help problem solve any issues you have. It also helps your project officer better know what is going on and what might trigger a prior approval request. These are great opportunities to discuss any kind of project director change, budgeting issues, change in scope, anything of that nature is important to bring up in those monthly calls, and your project officer will be able to help navigate you to whether or not you need a prior approval request. We really emphasize timely submissions being important. So I think that's been underlined and in red a few times, but just in case you missed it, timely submission of reporting requirements are very important. And there are quite a few of them. So if we go to the next slide, we will discuss some of those reporting requirements. There are the quarterly progress reports. That will include, by and large, your submitted updated work plan, staffing plan, substance use disorder funding, and a response to other questions that we might ask. Of course, those will be quarterly. The logic model and strategic plan are 2 deliverables that are going to be developed by all of you during the planning period within the first 6 months of the grant. You will be able to work very closely with the TA provider to work on that. So we're very excited to see those deliverables at the end of March. You will have semi-annual PIMS reports. That will be a highly quantitative report that will be discussed further in the ARCOR eval portion of the webinar and the sustainability plan. So as you see, there are plenty of reporting requirements for this grant, and I think you will all be happy to be able to leverage the expertise of the TA and your PO for any questions you might have regarding these reports. Next slide, please. Really quickly, wanted to provide you with an overview of the deliverable schedule for just year 1, just to give you a visual. December 31st will be the deadline for your quarterly progress report, that first one. March 31st is going to be the formal submission of your logic model and strategic plan, along with your second quarterly progress report. June 30th would be your third quarterly progress report, and the beginning parts of that is actually just not correct. I'm sorry, that should not be there. It should just be quarterly progress report. And then September 30th would be your quarterly progress report, PIMS, and sustainability plan part 1. I'm so sorry about that. So if you're looking at June 30th, just think, man, that's going to be an easy day. It's just going to be a quarterly progress report. So yes, we'll update that for you before we send out the slides. And just a note at the bottom, all deliverables must be submitted into the electronic handbook. Next slide, please. I want to end with some things that are coming up really soon. The ARCOR conditions that are due October 30th, all of you have the condition that you will be submitting baseline information about substance use disorder funding, consortium membership, and staffing. That information, that template to help you report that accurately was sent in your welcome email. So please go back to that welcome email that was sent. It would have been sent by me, Monica Rousseau. So please go back and check that. And if you have any questions about that deliverable, please feel free to reach out to me. The other conditions are due on, many of the other conditions are due on October 30th as well. So please make sure to keep a close look at your NOA for what those other conditions are. They would be pretty different from grantee to grantee, and we're just happy to answer any questions you might have about any of those conditions. Next slide, please. I mentioned earlier about accessing EHB. I know a few of you are brand new to HRSA, so this is a slide just for you and a refresher for everyone else. To access EHB, you'll be able to click where it says click here so that you can always access EHB. There is some information about the EHB help desk as well. They are a huge resource that we hope that you'll be able to leverage whenever you have any kind of issue and trying to figure out how to navigate something. Just as a heads up, your view of EHB is completely different than our view of EHB. So if you ever want to call us and say, hey, I am trying to find where to find something, chances are we will not be able to help you, and we will politely give a warm handoff to the help desk. That is just because we absolutely don't see what you see. Next slide, please. So just a few next steps before I turn it over to Will Davis. Of course, right now we are having our welcome webinar, so that's exciting. We're kicking off this new grant, and we're just excited to have you all here and answer any questions. After this, we will be scheduling our introduction calls for the last 2 weeks of October. So that will give us a little bit of additional time to get to know you a little bit better, for you to get to know your project officer. And if the TA representative is able to join us, you'd be able to get to know your TA provider as well. After that, we will be scheduling our regular monthly calls. These will be recurring meetings to occur every month. Those will start in November. We also have a TA webinar on logic models and strategic plans coming up in November 9th at 2:00 p.m. That is where you'll get more detailed information as a cohort on the expectations of the logic model and strategic plan deliverables due formally within EHB on March 31st. We also have several regional meetings coming up. I think for a few of you, the regional meeting is scheduled for November. So please make sure to reference that welcome email and make sure that you are planning to attend your appropriate regional meeting. Finally, I referenced this earlier, there is a 3-day meeting coming up for this cohort for all 30 grantees to participate in. That is TBD. We will be scheduling it sometime within summer 2021 virtually after all of the regional meetings are completed. So with that, we'll go to the next slide. And of course, this is some information on, our agency and how to visit that. But for the most part, my portion of this of speaking is over. And like I mentioned earlier, we'll be going through the different people and resources for all of you. So this concludes the project officer and NAS program portion of the webinar, and we're going to transition now into the Office of Federal Assistance Management, where Will Davis will be presenting about grants management. So Will?
Well, good afternoon, everyone. I'm glad to be here. I've been speaking at quite a few of our ARCOR webinars lately. So I am mindful that I can't tell the same jokes twice, because some of you may have some of our other grants. So I'll jump right in, and I try to keep this kind of stuff interesting because I work in the numbers shop, and numbers are fun for me, but are often scary to some folks. But when it involves money, it's always fun, right? All right, so let's jump right into it. Next slide. So who are we? The grants management specialist is responsible for business management matters. We're responsible for your budget and reviewing that, as well as other aspects of your award, reviewing submissions and reports. And I'd like to say that, we're taking the moment to introduce us, your grants management team, because oftentimes it seems like your best friend is your PO, who reaches out to you all on a consistent basis, like you just saw their faces. And it's a little different for us in the grants office. We generally have many more recipients per GMS than a program officer would have, but that in no way means that we are inaccessible. We are here. You may not hear from us often, but we're here as a resource. And as was highlighted, if you look on your notice of award, you can find both contact information for your program officer and for your grants management specialist. So next slide, please. All right, so monitoring is a joint responsibility, and I need to update my picture because these phones are slightly outdated. We're a little bit ahead of the curve now these days, but you have a team of the program office and the grants office. So we jointly are responsible for monitoring your award, and this is a team effort. We're looking at not only your progress on a monthly or quarterly basis, but we're looking to make sure all the terms and conditions and reporting requirements are met, that you're staying compliant with the award, and generally providing technical assistance wherever possible. When you do any sort of changes within EHB and submitting documents, many of them is under what we call dual review. There are some things that go straight to the program officer and we don't see them, but much of what you submit is under dual review. So both your program officer and your grants management specialist review it. And whenever you receive an award, a notice of award, it definitely comes from our grants office. Is the last stop before it gets out of the door. But we're here together as a team. So the next question is, when do you contact your program officer and when do you contact us in the grants office? Next slide. So for budget, reporting, and other administrative requirements, you can contact your grants management specialist. For project goals, scope, and other programmatic requirement questions, you can contact your project officer, but here is the key. We're all involved in this together. For example, Monica was just discussing some of the budget matters. Well, that's because the program office is heavily involved in your budget as well as the GMS. And although we're focused on the budget, we have to make sure that programmatically you're operating up to speed. So this is sort of kind of a trick question, because when you do contact us, you may need to CC both your GMS and your PO just so that we're on the same page and in the loop together. Whether you do that or not, we consistently try to speak with each other whenever it's pertinent, but never feel bad about copying both your GMS and your PO if you have a question. Because even if it's not budgetary related, we need to know what's going on with you and any other services that we can provide. Next slide. So here is the life cycle of a grant. So the first thing we do is the planning and announcement portions of the cycle. And that is when we are working years in advance. Specifically for this program, we didn't start working this year or in January. This is stuff that we plan far out in advance. And once we plan it, we're able to write a notice of funding opportunity and then release that notice of funding opportunity, which you all saw, applied to, and yay, successfully you were awarded. So we're in the next phase, which is the green phase, where we have reviewed your application, decided your award amounts, and given you a notice of award. So I want to stop here because there's some information I do want to share briefly. I know Monica showed you the page 1 of the notice of award, and many of you may be HRSA recipients in the past, or currently have other grants, but I know we have one person who is brand new to HRSA. But I just want to highlight, as of October, the notice of award layout has changed. So it's going to look slightly different from what Monica showed us. So this is not a huge change, but just want to make you aware, so that if there are any revisions to your award, if there's a condition that's lifted, or if you submit a prior approval to change your project director or anything, and you receive a notice of award, I don't want you to be flabbergasted that it's going to look slightly different. So we wanted to make it more user-friendly. So a lot of your pertinent information that you might have had to search for is going to be on page 1. A lot of the information that you saw in this PowerPoint, in that slide of the notice of award, will now be on page 2 instead of page 1. It is always the government's job to keep you utterly confused. So that's why we're kind of moving the target around. Now, not really, but we're making this change, and actually it's something that we're trying out here at HRSA that may go government-wide. So we're hoping that the new layout of the notice of award is more efficient and user-friendly for you. And then the last part in red is our post-award and monitoring phase, which is where we are now, monitoring your progress, and then later on we'll be closing out the grant in years to come. Next slide. So entering this award phase, the program official, or project officer, reviews the outcome of the objective review panel, recommends the applications for funding. The GMS, as I said before, works up the award and releases that award and lets you know, not only, I know many times when we receive a notice of award, we're really excited. We automatically start CCing everybody in the office. Yay, we got a grant. And our eyes fall down on how much money we got. And then we may fold the award up and file it in a drawer, never to be seen again. So make sure that you are thoroughly reading your notice of award, as Monica mentioned, with all of those terms and conditions that are listed. That is somewhat your Bible as far as what is due for you. Your notice of funding opportunity that you applied to, please don't file that away. Keep that somewhere where you can easily find it, because the notice of award tells you what's due. The notice of funding opportunity is sort of kind of your Bible as it refers to what you can do and what this program is about. So please keep those in the forefront of your mind to make sure that you remain on base. Next slide, please. All right. So as you can see, the post-award and monitoring phase, as we said, is a shared responsibility with all parties. The recipients must ensure that key project staff members work collaboratively with their assigned GMS and PO. Recipients are also required to communicate to HRSA any changes they propose to make to the approved program and/or budget through a formal process called a prior approval request, which I'll get into the more common requests in just a moment. So the GMS works with the PO to evaluate each request. The PO will recommend the course of action, and the GMS is responsible for rendering final HRSA determination. So your grants management specialist monitors the grant's financial account. We reconcile your financial reports. We validate responses to conditions and receipt of required reports. So that's what we're here. It's a constant monitoring going on our end as you guys carry out the great work in your application. Next slide, please. So as recipients, you have full responsibility for all aspects of the performance of the award, including performing the scope of work, proper accounting, monitoring and financial record keeping, and reporting. Following topics in this section will provide you with information on the importance of complying with all reporting requirements and how to succeed in managing and maintaining important official records. So there is one of the main reporting requirements, which is an annual requirement, is the federal financial report. All right, so new information. If you are used to having any sort of federal award with HRSA, the annual financial report, which is the SF 425, would be completed in the EHB system. As of October this fiscal year, the annual FFR is completed in the payment management system, right? So we're trying to make things a lot more user-friendly. So if you are drawing down your funds from PMS and doing quarterly reporting in PMS, and then doing a separate annual report in EHB, and oftentimes these reports have similar or the same name, and it was confusing to our recipients for years. So we migrated all that budget stuff over to the payment management system. So it's really cool. So when you do your annual FFR, it's gonna automatically feed into a report submitted in EHB. So for those of you all who are used to doing reports, financial reports at EHB, you'll now be doing that through the payment management system. So record keeping, you are required to, as part of your Code of Federal Regulations, you are required to maintain 3 years the records, any records, documentation concerning this grant for 3 years after the period of performance. So once this project is over, you know, I know when I was in school, once I passed the class, I had a book burning party and we would just burn all my textbooks. Well, you can't do that with program documentation. So you want to hang on to that for 3 years before you have a paper burning process party. So just in case there's any sort of audit, litigation, or any action involving records, we'll need that information. Next slide, please. So let's get into what are some of the common types of prior approval requests that you may submit to HRSA. And keep in mind, we do a really good job here at HRSA at trying to make sure that our review and communication with recipients is timely. So once you get us a prior approval request, it is our job to make sure that you receive some sort of response from HRSA within 30 days. So this is something that takes several offices to review, but we're still trying to make sure that you get the answer you need so that there's no delay on your end. Next slide. So some of our common prior approval requests would be if there's a key personnel change. There's a specific prior approval called a project director change. So if your PD for your grant changes, you can come in and submit a program director change. There are some times where you just want to let us know that some very important folks are moving around or changing. And so that one is different. That's called a key official change. So if you hire a new CEO, or you have a new COO, or you change your medical director, and you just want to let HRSA know, that would be called a key official change. Another thing that you may want to do, if you applied and you said you're going to do A, B, C, and now on the ground, you've done a little work and you realize I need to change what I said I was going to do from ABC to possibly CDE. That may constitute a work scope change or a change in scope. This is something that I would encourage you to reach out to your program officer and explain the situation, and they'll let you know if there's anything needed in the EHB system by way of prior approval. Monica talked about rebudgeting over a certain threshold, and we call that in the grants office the 25% rule. I'll go into a little bit more in depth about that specifically because it's a little bit more nuanced than just 25%. So you can move a certain amount of funds without letting HRSA know. And so I'll highlight that in just a minute. Next slide. So there are less common prior approval requests. One is a request for a supplement or emergency need. There are times where a recipient has certain circumstances where you may need to request additional funds from HRSA. Now, generally speaking, there's just a very few circumstances where we would consider that, because I know we're the government, but our pockets aren't quite as deep as you may think they are. Otherwise, we'd all be rich, right? So there are situations where you need emergency funds, but there's also situations where it may not be an emergency, and it may be we're doing such a phenomenal job that if we had just a little bit more, it would allow us to accomplish X, Y, and Z. Again, these are not common requests, as we have to plan our budgets far in advance. So it's very infrequent that we see that. So we also have a change of recipient, be that by way of transfer from one organization to another, or what we would call a merger or successor in interest. Just keep in mind, this is, maybe I should change this because it's becoming more common than less common at this point. But you all just sweated for hours and hours and hours doing an application, so nobody wants to change their grant, right? But if you do reach a situation where, and I won't go through those, but there are certain situations where there may need to be a change of recipient, and the grants office is primarily here as lead on what documentation needs to be supplied. The other one on your screen, fingers crossed that we don't reach that point, but you also may need to relinquish your grant because you cannot carry out all or part of the award. And again, you would want to reach out to the grants office, but we would all be speaking together in that case. Next slide, please. So I'll skip through these because this grant, I don't believe, includes anything concerning property. But there are times where you may need to ask us whether you can sell equipment. Again, we'll be very brief about that because the program just started 6 days ago. If you just bought something and are trying to sell it already, that would raise all kind of red flags. There's also something called a deviation request from certain terms and conditions. I won't even get into that. These are very, very less common requests. Next slide, please. All right, so let's talk a little bit about procurement. If I'm putting you to sleep, please put some ice on your face. I'll try to crack a joke here and there, but we've got some very important stuff that we want to highlight. So it is incumbent upon the recipient to have written procurement procedures. You cannot see me. I am not on video, and that's probably a great thing because I have a face for radio, not for television. But my arms are out very wide. You must have written procurement procedures, and you must know the Code of Federal Regulations and make sure that your written procedures reflects what is required in the Code of Federal Regulations. If I had a $2 bill for every time I get a call when your auditors are there and they tell you that you didn't do something that you were supposed to do, and the recipient comes back, hey, can we get an exception to this rule because we might end up with an audit finding? Well, I can't go back and do that. So this is why we're trying to be as diligent as we can on the front end. HRSA does not review written procurement procedures or individual contracts unless we're performing technical assistance or a special review. But please use the CFR and the grants policy statement. You can just Google HHS GPS or the grants policy statement as your guide to federal requirements. Contracts, I'm going to slow down here, contracts above the micro purchase threshold, that's in the Code of Federal Regulations. Contracts above the micro purchase threshold must be completed. There's no requirement because there's this rumor going around that you have to have 3 bids when you're finding a contractor. That's not true. The CFR simply says an adequate number of sources. A recipient may enter into contracts using the sole source method where we don't compete it. We often have recipients who enter into agreements and retroactively request exemption from the rule to have open and fair competition in an attempt to avoid an audit finding. Exemptions are not granted for that purpose. Please ensure you're aware of the CFR prior to entering into agreements. So if you enter into if you're doing a contract based on micro purchase threshold, not over that, you don't have to bid that. If you are doing a sole source contract, please read the notice of award, because a lot of people are like, well, I know who all the players are, so I'm not gonna put this out to bid because I know exactly who I want to contract with. Well, you have to be mindful of the Code of Federal Regulations. There are only certain situations where you're allowed to do a sole source contract, so make sure you read that section of the Code of Federal Regulations. Woo, I said a lot. All right, next slide, please. So I get this question all the time, so I just threw this in here for fun. There is a difference between a subrecipient and a subcontractor. We oftentimes will use these terms interchangeably, but they do have a meaning in the Code of Federal Regulations. A subrecipient carries out a substantive portion of the award, meaning they are doing something that you said in your original application that you were going to do. A subcontractor just provides goods or services. So if someone is doing work for the grant, not just providing a service, not just providing a good, they would be considered a subrecipient. The definition of a subcontractor and subrecipient is found in the Code of Federal Regulations. I am mentioning that because there's different treatment and responsibilities of a subrecipient versus a subcontractor. Again, we do not review those contractual agreements at the recipient's request. We have a lot of folks who just like, I want to be above board and make sure I don't get in trouble. Here's all my contracts, read them. As much as I loved contracts in law school, it is just not feasible for us to read all contractual agreements. That's why we try to give you as much information and technical assistance as possible. All right, next slide. All right, let's talk about FTE, and I'm going to try to be brief, but this was already mentioned by Monica, so I just want to highlight a couple of other things. So we talked about and you don't see it here on the slide, Monica mentioned the salary rate limitation of $197,300. And the statement was you can't charge a federal grant above $197,300. The precise way to say that is you can't charge at a rate above $197,300. So we have some people that will pay someone $50,000 and you say, well, they're not above the salary rate limitation because I only paid them I only paid them $50,000. Well, the rate is $197,300 divided by 2,080 hours in a normal work year. That means you cannot pay anyone with federal funds above $94.86 per hour. $94.86 per hour. Now, I know all of us are rich and we all on this webinar make $400,000. So the question is, how can I get the rest of my money if I'm making $400 and I can only charge $197,300? So you can charge the rest of a person's salary in non-federal funds, but with federal funds, they can't be paid more than $197,300, and they also cannot be paid at a rate above $197,300, which is $94.86. Got it. All right. The next thing is we mentioned billing across federal awards. And this is kind of nuanced, so I just want to provide a little bit of clarification. So we don't like to see a full or part-time employee being billed above 1 FTE across federal awards. That is because we don't want duplicative effort and we don't want what we call double dipping. All right, so duplicative billing for the same type of service. This is a nuanced situation because those of you who are used to dealing with money realize that you have overlapping budget periods. So not all of your budget periods begin on September 30th. You may have an award that begins April 1. So somebody could be listed at 0.5 FTE on one grant and 0.0 FTE on another, but on your books, you know, they were finished with that 0.0 FTE at month in July, and we didn't even start the other FTE until August, or their FTE was reduced at this point because we got this other grant. All right. So we're giving you very generalized terms, but I know how this works on the ground, and it is not as cut and dry as what you see on the screen. So keep that in mind. So what if someone is getting paid 0.3 FTE with federal funds and they're still working full time? What about the other 0.7? Well, you could use non-federal funds for 0.7 and only charge HRSA 0.3. Well, what if someone is 0.3 on this grant and 0.7 on another grant? That's fine. Now, here's a question, because I know it's a burning question in everybody's mind. Can someone work more than 40 hours in a week and it not be considered overtime? Generally speaking, if you have somebody working 50 hours a week, that would be considered overtime. Overtime is reflected in the fringe line item, not in our regular salary or contractual line item. Generally, that is a fringe benefit. But can someone work more than 40 hours in a week? Especially when you're dealing with part-time people, there may be a week that someone works 50 hours and they're not exactly charged overtime. You have your own procedures there, but our main goal here is that you know that there should be no duplicative effort, no duplicative billing, and you cannot have someone stating that they're across all awards at any given time working time and a half or 80 hours in a pay period. That is going to raise eyebrows. All right, next slide, please. And again, if you have questions, I'm going to stay on so that you understand. So we talked about the rebudgeting rule. I'll come back to carryover requests in just a minute. So we said it's 25%, right? So the way that works is you can move funds approved budget costs between line items, federal line items, up to 25%. What does that mean? It means if these are for costs that were already budgeted, you can move up to 25% without letting HRSA know. You cannot rebudget for costs that were not in your budget. So if you're adding something that was not present, you need to know that because it could be an unallowable cost. The second thing is, if you're moving money, let's say you didn't have any money in your equipment line item, but now you want to move some of your supplies money into the equipment line item. You can only move it if there was funds in that line item, okay? So if there was $0 in equipment and you're trying to move it to that line item, move funds to that line item that you did not budget for, you would need to let us know. So it's 25% rule for approved costs. All right, I'm cooking with grease. Let's go to the next slide. Oops, except for that wasn't true. Back to the previous slide before. So carryover requests. So after this year is over, I know that some of you get off to the ground running, and then there are some people who have issues getting started. There are some people who may have staff changes, and for whatever reason, you may end up with an unobligated balance reported on your federal financial report. When you do that, you would submit one of those prior approval requests. And I want to say this, I see a lot of carryover requests because people feel like once I get a grant, I'm entitled to it and I don't have to say much about it. Just give me my carryover request. Just because you write, I want $25,000 in a carryover on a dirty napkin that you Xerox to the copy machine at your place of business doesn't mean that that is a thorough carryover request. So here's what I encourage all recipients to how to operate. Treat a carryover request, a carryover budget, just as seriously as you would a competitive application. There should be no difference between what I see in a SF-424 and a budget narrative or budget justification. That same level of detail for a carryover request should be the same level of detail for a rebudgeting, should be the same level of detail as your original application. Take that very seriously. so that we have a good understanding of exactly what it is that you would like to do. Next slide. I was serious this time. Next slide. All right, there we go. So managing your HRSA grant. This is a website that I hope that you all are already familiar with. I am not a recipient, and I hang out on this website quite a bit. So I wanted to give you a snapshot of what it looks like, but if you hit that link and go to the Manage My HRSA Grant site, there is a wealth of information on FFRs, on how to sign up for EHP accounts, for uniform administrative requirements, which is what I was referring to as the Code of Federal Regulations for the CFR, our policies. There's cool videos that will help you point, click, know how to submit things in PMS, how to submit in EHB. So there's a lot of information. I know the easiest thing to do would be like, I don't know, I'm just gonna ask my PO or GMS. But there's a lot of your questions that'll be answered right here. And this is great for making sure that you, quote, stay out of trouble so that you know how to be compliant with everything required of you. See, I talk a long time because I don't have a lot of friends. In the grants office, we just kind of do sometimes. And so I go over because I get so excited talking to you all. I'm gonna stay on. I believe this is it for me. And any grant related questions, let me know. Now, if you don't have any questions, make up a question. Otherwise, my self-esteem will get low. But I'm around, and congratulations again. Next slide. So we'll get to Q&A later on. Thanks, everyone.
Hi, this is Kathy Myers. If you can go to the next slide. Fraser Byrne and I and Robin Baker will talk with you about the evaluation. And we want to say welcome. We're excited to work with all of you and really help you understand what your data say and how your data compare to other grantees in your cohort. A little bit about us. We are clinical evaluators, meaning that we have on the ground real world experience, and I like to say no ivory towers. Most of us on both teams have spent a lot of time in the trenches, both working in different clinical programs, recruiting individuals on the streets through needle exchange programs, halfway houses, crack houses, particularly when the HIV epidemic was roaring. So we've got a lot of real world experience with tribal communities as well. Importantly, we listen to you and we believe in the power of data. I think that as you will see some of the things that we will be providing to you, that data mean a lot and can go a long way in helping you potentially leverage other funds and tell your story. And we also work to link the results that we're seeing to different improvement efforts at the TA level that Monica had talked about. So the evaluation and the TA team work closely together to provide information in both ways to help you guys move things forward. If you can go to the next slide. This should be our staff. So we have both staff at JBS. I am the project director of the entire evaluation. The JBS portion of the evaluation is looking at the initiative's impact. And Robin Baker from Oregon, they are looking at the evaluation of the effectiveness of technical assistance. So it's our two teams that will be interfacing with you on the TA level. If you go to the next slide. So what's our primary objective? Help you and HRSA tell the story about what's working in rural communities around neonatal abstinence syndrome. And equally importantly is to help you use your data for quality improvement and for you to be able to tell your story. If we go to the next. So what are we going to look at? We'll look at reach in terms of how many individuals have you touched in all of the different areas that Monica had mentioned. Are you implementing in a way that makes sense for you? Are there changes that need to occur? Are you on target to meet your deliverables? What is the impact? in various different, within various different types of services, and how does your, are there different types of consortiums that have different impacts, and what might that look like? Adoption and maintenance is when you find something that works, are you able to disseminate? Are you able to keep it going? And what does sustainability look like for your consortium and for the activities that you're implementing in your communities? If we go to the next. How we'll do it, obviously ask questions. Importantly, one of the things that we've done as an evaluation team in conjunction with HRSA is that we try to minimize burden on the grantees, and we're working right now with two other, or probably 5 other cohorts, but 2 in particular that we're spending a lot of time with. We have quarterly reports that you're required to submit for oversight, and we're using that data for evaluation purposes so that we don't have to come back to you for multiple asks. There will be a couple of surveys that we will ask you to complete, and there will be interviews with your project directors or the designee, but we're really trying to minimize our asks to you by using available data to be able to do this work. We acquire evidence, we look at the strength of that evidence, we apply it and we distribute it. And we apply it and distribute it in 2 ways, both in terms of any TA implications that may be there, and then also distribute the evidence to HRSA and FORHP so that they can ascertain, is this an initiative that's doing what they wanted it to do? Okay, next. So how will you know what we're finding? So you'll have your own analytic dashboard, and that we will show you what you're finding, what we're finding. Within that dashboard, you will be able to look at your performance in relation to your cohort, and there will be other filters. We're working with Monica right now on what those filters might look like. Right now within some of the other cohorts, we're looking at Medicaid expansion versus non-expansion states. I'm not sure how your cohorts, what you look like in terms of that, whether that would be a reasonable dashboard, but there will be different filters that you will be able to apply. You'll be able to use that to request TA. So within your dashboard on a web portal, you'll be able to go to the TA website, leverage other funds, and then use the data to inform your grant-specific evaluation. Importantly, when this becomes operational for you, the data that are in that dashboard, you will be able to download. It will already be cleaned, ready to go, and you can then analyze it within your own consortium in a way that makes sense for you. Okay, next. So let me give you an example. One of the PIMS measures is the number of providers who have a data waiver that are within the consortium. So in this particular example, at 6 months, you can see that within the consortium for the entire portfolio, you've got roughly about 2 consortium members have a data waiver, where the consortium, your consortium would have 1. So we would provide that information to you. Potentially you receive TA to work with you on how to engage people who are eligible but do not have a data waiver. And you can see over time that you were able to surpass the average. So with TA, you were able to jump up from 1 to 4 people with a data waiver. These are the kinds of things that will be displayed on your dashboard, so that you can see both how you're doing, whether you're improving, what your improvement looks like in relation to others, and then if TA has helped or not. Next. Very similar type of information. This is really just showing you over time that you're able to increase the capacity of your consortium to have a data waiver, and you're really now approximating other consortium members and the number of people within their consortium. The data will be displayed in predominantly 6-month intervals. Most of the data are PIMS right now, but we're working with Monica to ascertain what additional questions we need to add 2 quarterly reports so that they are specific to the work that you'll be doing with this population. Next. So we'll provide you with usable results, and we say in real time, so I want to be clear, real time doesn't mean tomorrow, but we do turn data around as quickly as we can. Generally, particularly the quarterly report data comes out really quickly. PIMS data takes a little bit longer, but we will get that on your dashboards within 2 to 4 weeks of it being cleaned and ready to go up. I don't know what phase your dashboards will be in, but we'll let you know that later on in terms of when you will come into the fold. But as soon as you get into the fold, you will have ready access to those dashboards. What we're asking in return is that you participate with us and you report high quality data. We have a number of different guidance documents to help you do that. And the few surveys or the couple of surveys that we may ask you to complete in the interviews, we're really urging you to be able to participate with us, because without your data, then we can't tell your story, the initiative story, and you won't be able to look at your performance over time. Next. Okay, I'm going to turn it over now to Fraser Byrne from HRSA.
Hi, Kathy. Thanks so much, Kathy. Hi, everyone. My name is Fraser Byrne. I'm the program coordinator for the evaluation team here at the Federal Office of Rural Health Policy. So as Kathy mentioned, PIMS data and how we plan to use it and how we plan to give the data back to you in a usable format. I have the fun task of walking through what the data requirements are. And you're going to hear a lot more about this. We just want to make sure that you are familiar with the process and when the PIMS data will be reported, but you will get much more guidance around data collection and reporting before then. So I can go pretty quickly through this, but just wanted to highlight for you quickly. As Monica mentioned earlier, reporting data in PIMS is required for our core grantees. The lead applicant or grantee is responsible for reporting data on behalf of the consortium. PIMS is our performance data system. It's accessed through EHB. And these measures that we're asking have been approved by the Office of Management and Budget. So as I mentioned, you won't be reporting PIMS data until September 30th of 2021, which feels like a long way off, but we want to make sure you're prepared for that. So the data entry window opens September 1 for that deadline. The reporting period is listed here. But again, don't worry, you'll be receiving much more guidance around data collection and reporting between now and then. And just for your awareness, after you submit in PIMS, the data are reviewed by your HRSA project officer, so Monica or Mabrat, and the JBS evaluation team. So together we will follow up to share any feedback we have about your data, ask questions, or to request revisions. Next slide, please. We understand that data reporting can be challenging, particularly in rural communities. And to help grantees collect and report high quality data, like Kathy mentioned, HRSA and JBS have put together some data collection resource documents. These were initially built for the implementation grantees. So you'll see those terms in there, but the measures are the same for you. And they are all available on the RCORE TA portal, which you'll hear more about after evaluation speaks. And we will walk through these, a couple of the resources real quickly in the next few slides. Just for your awareness, general data sharing and best practices, technical assistance is available through RCORE TA. And just a note that the PIMS data that we collect do not require you to share personally identified data with HRSA or your consortium. So that is not required. We only need aggregate totals across your consortium. So just want to make that clear. If you review these resources and still have questions, you are absolutely welcome to email the RCORE evaluation team. After each data reporting period, as I mentioned, you'll get feedback on the data you submitted. Again, we understand there may be limitations to your data. And in order for data to be meaningful, we ask that you add comments as necessary in PIMS. You'll get more information on that as well. So next slide, please. So here is a link to the ARCOR TA portal page. I highly recommend you bookmark this page. We make updates to the resource document and the other resources that live here. And so this will always be the link to the page to find the latest and greatest version. So on this page, you will find data collection resources that were created specifically for ARCOR grantees. And we really try to anticipate the questions that grantees would have. And the reason we keep making updates is we collect the questions that grantees have and the responses that we give, and we add additional guidance or examples or data sources to this resource document to make it even better. So highly recommend you check it out. It has general data collection guidance and tips for reporting, including key terms, definitions, examples, and suggested data sources for each measure. You'll also see in here the list of all the ARCOR measures that will be reported in PIMS. And there's also screenshots and steps on how to access PIMS in EHB. Again, you will not be reporting for a while, but we want to make sure you have these resources now, and you will get more guidance as well before then. There's also an Excel workbook on that portal page, which I will go through in the next slide. Yes, thank you. Perfect. So this is just another resource on the portal. It is an Excel workbook that we developed to facilitate data coordination and collection from consortium members. So the workbook includes columns to record data for each PIMS measure and capture the data that's reported by each consortium member. And then it has formulas in there, so it automatically aggregates the data that you would report in PIMS. So it is completely optional to use, but you're welcome to use another system if it's working well for you, but we wanted to offer this for some of our grantees who may not be used to collecting data like this from multiple partners for reporting. All right, and then next slide. Great, so this is just a list of the types of ways you will interface with the evaluation team. We'll be providing feedback on your PIMS measures that you reported. You will hear from the evaluation team about consortium member assessments that we're planning to do on an annual basis. There's, as Kathy mentioned, a limited number of interviews and survey requests. Again, being mindful of the burden on grantees. We don't have a lot of these. We really try to squeeze as much juice out of every piece of data you already submit. And you will get notifications about the data dashboards, and we look forward to sharing more information with you about that. Here is an email address for the ARCOR evaluation team. And that is a general mailbox for a number of folks, so you can get a quick response. That's the best email address if you have a question about PIMS, and you will be receiving feedback from that email address. I recommend adding that to your safe senders list now, so that any feedback, any emails that you get are actually seen by you and not caught in a spam filter somewhere. And really quickly, I just want to mention, I see a question in the chat about the specific measures for NAS grantees. The resources were developed for implementation and MAT expansion grantees. However, you will be reporting the same measures. So we will give specific guidance to NAS, to you all, on those measures that's more specific to NAS activities, but those are the same measures. So I just wanted to respond to that question while I was talking about it. And now I'll hand it over to Robin Baker. Next slide, thanks.
Next slide, please. Hi, everybody. I'm just going to go through this really quickly because we're almost out of time. So I'm Robin Baker, and I am from OHSU. I'm the project director for ARCOR TA evaluation, and our primary role at OHSU is to specifically focus on the evaluation of technical assistance that is provided to you. So real quickly, the primary objectives are to identify opportunities to improve technical assistance to better support you. And that could include identifying potential topics or modes of delivery that you need and will find helpful. And then also just developing a better understanding for the most promising practices and meeting grantee needs with TA. Next slide. We evaluate technical assistance in a variety of ways. Our primary methods are periodic and annual surveys to capture your experiences. And then also we will do interviews and site visits with selected grantees to collect more in-depth information. We're also looking into this year doing some content analysis on pre-existing TA information to again reduce the burden on you. Next slide. So we recognize that you are all extremely busy doing important work in your communities. We will do our best to reduce the burden of participating in TA evaluation. However, we do want to emphasize that evaluation is critical for improving the process and content of TA and for ultimately ensuring that TA meets your needs. So we need to hear from you in terms of what's working, what isn't, and especially hear your thoughts on how technical assistance could best support you. Next slide, please. Here you can find our email addresses below, both for the ARCOR evaluation team at JBS, as well as the ARCOR TA evaluation team at OHSU. And please do reach out if you have questions or concerns. And I just want to say thank you. We are all looking forward to working with you.
You can keep going, Unica. Thank you. Next one. Hi, this is John Roberts, and I'm the coordinator for TA. And I guess I will say we have 4 minutes with you now and then 3 years with you on your grant. So we will go from there. So next slide, please. So we do everything from, as you know, webinars today, universal TA, to learning collaboratives, policy academies, and also individual TA, site visits, and intensive TA with your grant individually. And that's the quick version of that. You will get the slides. Next, please. And this is our team, and I will let them introduce themselves in just a sec. Just letting you all know that we do have another webinar scheduled with you on November 9th where you'll be spending an hour and a half with this team. So I do want to say, although we're a little short today, we will be working with you over the 3 years. And these will be your TELs. We call them TELs. You can call them coaches, and they'll never make you do push-ups or sit-ups. They're not those kind of coaches, but let them introduce themselves really quick and talk a little bit about themselves. And then we'll see how we do with Q&A if you can hang in there with us. So next slide, please. Carrie, do you want to go ahead and introduce yourself?
Yeah, hi everyone. Very quickly, I'm Carrie Earle. I'm based in Reno, Nevada. This is the list of the grantees that I will be having the pleasure of working with. My background includes a variety of state experience, community-based organization, leadership, and for the last about 20 years, I've been working across the country with states, tribes, local communities, and community-based organizations to try to really look at that cross-systems intersection around this population of pregnant and parenting women with substance use disorders and their infants and their family members. So excited to get to know you all. I'll hand it off, yeah.
Thanks, Carrie. Sue and Teresa.
Well, my name is Sue Gadach, and I am located in Milwaukee, Wisconsin, and I've got over 30 years of experience in health and human services. The majority of that is in mental health and substance use disorders for women and women with dependent children, and that includes prevention and early intervention programs for pregnant women with alcohol and substance use, drug exposed pregnancies, and then also designing and delivering treatment programs, and then gender specific recovery programs. So I look forward to working with all of you as well. Thanks.
And good afternoon. My name is Teresa Lemus, and I get to have 8 sites. I also work out of the Reno, Nevada office. My background is in nursing and in counseling, and I've spent the last 20 plus years, I'm aging myself there, working with lots of different populations, but primarily with a family-centered approach, pregnant women and their families, and so I look forward to working with all of you. Thank you.
Okay, next please. Very quickly, I will go over this more in the next webinar, I promise, because we're running out of time, but regional meetings, I just want to say real quick that The first regional meeting is November 17th and 18th. That's for the southeastern region in the United States. You may have gotten to save the date. You will get an invite for that. So that's the only one I'll mention today because that's the one's coming up quick. And then we're going to roll out one every 2 months throughout the contract year. So let's move on to Q&A real quick. We did have a couple of questions for Will. I don't know if you saw those, Will, but one of them was about what is the micro purchase threshold?
So I thought, I'm not technologically advanced, but I did answer that in the chat. That is $3,000. That is found in the uniform guidance. If you have a copy of the Code of Federal Regulations, and you can do a simple control fine for micro purchase, you'll see that right now it is set at $3,000.
Okay, thank you. For those who are worried, Will and I know each other, so if I'm teasing him about being asleep, it's okay. So one other question from Mr. Thomas. Will, I don't know if you were able to grab this one too online, but concerning the total 1.0 FTE requirement, if we cover a 0.25 FTE position and another organization covers the 0.75, is that okay, or does that exceed the 1.0? I think you covered this, but just to go over it one more time.
So I did answer that one as well in the chat. So I said that that's perfectly fine. The issue isn't who pays, but the issue is ensuring that an individual staff person is not working several competing positions that add to greater than 1 FTE. So if you have your recipient, you as the recipient is charging for 0.25 of a person's 1 FTE salary, and someone else or some other source of funding is picking up the other portion of that FTE, that's completely fine. Our issue here is just making sure not that there's multiple sources of funding. That's part of the grant, that we want you all to be sustainable and have multiple sources of funding. So that's fine. We just want to make sure that people aren't working more than 1 FTE in a way that results in duplicative time and effort.
Okay, thank you, Will. As we're running low on time again, I do want to, those are the questions that we had, and thanks for your participation today. Just back over to Monica for closing remarks.
Well, my closing remarks are just to say thank you to everyone, especially the TA portion of this webinar, for being so flexible and consolidating that information in a whopping 6 minutes. Looking forward to hearing the wealth of information that you will present during the November webinar. I do want to just remind everyone that you can ask questions at any time to your project officer. We are happy to take your questions. And we will be shortly navigating you in email format with your project officer and your TA provider, or your coach, as John said, no push-ups included. And we'll be scheduling your monthly call soon. With that, I want to just thank you all for participating in the Welcome webinar. Welcome again. Congratulations again. This was a very competitive grant and you all made it. And we're just so excited to have you on board. Yanika, I don't know if I need to do, I'll turn it over to you if there's any other logistical
No, nothing else. Thank you very much.
Perfect.
I just want to let everyone know we will be giving out and distributing the PowerPoint slides to you all, so that way you have all of this information here soon. And then I would like to thank everyone and have a great rest of your day.